I am now 24 weeks. We've reached viability. Viability means that the likelihood of baby surviving outside of the womb is so much higher now. Of course, if she was born prematurely, she would need a lot of help. Like she would definitely have to go to the NICU and be on all kinds of tubes and things like that. But 24 weeks is viability. So I cannot believe that we're here finally at the 24-week mark. My husband and I are heading out the house right now. We're going to do our 24-week ultrasound. It's always so fun, like seeing her on ultrasound. We love ultrasound days. So come with us to go see her on ultrasound. I'll take you guys with me and let you guys know exactly what to expect and how it goes. So this is going to be like a full anatomy scan. They're going to look at baby's brain, their skeleton, their kidneys, and just make sure that there's no structural abnormalities. But what I didn't realize is that they were going to put my baby girl on a 3D ultrasound, and I was in awe. I loved that I was able to see her little face. To me, it kind of looks like she has hair already, but according to all the apps, all they actually have is peach fuzz right now. At the ultrasound scan, they're also going to do measurements, so they'll look at like the legs and they'll measure the bones, and they're basically just looking for any genetic defects or anything that could be wrong with growth and development of the baby. Not only are they going to look at baby, but they're also going to look at your placenta to see if it's covering the cervix, close to the cervix, and also the blood flow through the umbilical cord. Look at how you could just see her head turning and just her little legs and arms are moving so much. She's getting so squished in there. I also had my 24-week OB appointment this week. I got to the office and they did doptones on the baby just to get the heart rate. They did a fundal height, so they measured the top of my fundus to my pubic bone to see an estimate of how many weeks I am, to see if it's lining up with the average. We booked my 28-week appointment and then they put in 4 labs. So that's the main thing that comes out of the 24-week OB appointment. They put in labs for me to do my 1-hour glucose test and then an RPR and also another CBC. The glucose test is to see if you have gestational diabetes, which is diabetes in pregnancy. The RPR is a routine test that they do throughout pregnancy to test for syphilis, and then they do a CBC as well to look at your hematocrit, your hemoglobin, and your platelets, and also to check for anemia. This is a summary of like all of the OB appointments and how they routinely schedule them based on my doctor, my OB that I go to. I've seen a lot of women talking about the gestational diabetes screening here, like on social media, and some of the searches are like, how can I pass the gestational diabetes screening, the glucose test? That's really not a good way to look at it because you want to know if your sugars are controlled or not, because it can cause a lot of issues in your delivery. Not controlling your sugars can lead to an abnormally large baby, which can lead to a shoulder dystocia and bleeding in delivery. Not to mention, baby cannot regulate their sugars if they're too big, and if your body is producing too much insulin, that's really going to lead to a hypoglycemic baby at birth. And so the goal is not to pass the glucose test. The goal is to actually not develop gestational diabetes in the first place and control your sugars so that you don't have to be induced early because your baby was too big.